All right, welcome to today's webinar, Ending Poverty, Making Basic Income Feasible in Canada, brought to you by Tamarack's Vibrant Communities, Cities Reducing Poverty. We are a network of 80 plus cities and communities leading local collaboratives that are aimed at reducing poverty locally. My name is Natasha Pei. I'm the manager of Cities for Vibrant Communities, and I'd like to introduce you to today's guest host. So Tom Cooper is here of the Hamilton Roundtable for Poverty Reduction. He's helped us put together this webinar and has also co-organized a series of webinars on basic income with us last year, which we will send to you in the follow-up email. But Tom is the director of the Hamilton Roundtable for Poverty Reduction. He has served the collaborative for the past 9 years, tackling the city's unacceptable levels of poverty. He has advocated for social assistance rates that reflect the real cost of living, fought to end predatory lending in Ontario, and helped to co-found the Ontario Living Wage Network. What we are here to discuss today, though, is the learning that's come from Tom's and the Hamilton Roundtable's recent involvement in Ontario's first basic income pilots. Though the pilots were canceled prematurely, Tom continues to advocate on behalf of the 4,500 pilot participants for a resolution. And we're hoping that today's webinar will provide you the tools and talking points to help you also advocate for basic income. So welcome, Tom, and I'm going to hand it over to you to introduce today's panel.
Thank you, Natasha. It's great to be here. I know everybody's a little anxious today, but we're going to talk about the future and basic income. And we're going to use this fantastic document as a bit of a guide for our discussion today. It's Basic Income, Some Policy Options for Canada. And two of the authors of this important report are with us today. So I'd like to introduce Sheila Regehr. Sheila is a founding member of the Basic Income Canada Network and its chairperson since 2014. She was also former executive director of the National Council on Welfare, an independent advisory body to the federal government that published comparative reports on Canada's provincial, territorial, social assistance systems. Comprehensive poverty profiles and analytic reports focused on solutions. I'd also like to introduce Chandra Pasma, who is a policy analyst based in Ottawa. She specializes in issues of income security, poverty, and precarious work. She's worked in politics for nonprofits and for one of Canada's largest labor unions. As a longtime advocate for basic income, Chandra frequently writes and speaks on the relationship between basic income and employment. She is a member of the Basic Income Canada Network Advisory Council, and we are thrilled to have both of these guests with us today to talk about this important report, which has already made a lot of waves. So we're going to get into a number of questions I'm going to ask of Sheila and Chandra, and then it'll be time for you to ask your questions, and you can do that by submitting a question in the chat box, which is just below your window. So let's get into the first question. And really, it is a opportunity for Sheila to talk to us a little bit about the impetus for this report, why it came out, what were some of the principles you wanted to see incorporated in the report, and really why did you think we needed to talk on a national level about these policy options? Sheila?
Okay, thanks very much, Tom. So this is going to be like a really, really condensed version of BICN evolution since it was created in 2008. It started out as a really big tent. Whoever was interested in basic income, that was wonderful. We would talk. But there are different versions of basic income that are espoused. You've probably heard some of the more libertarian versions that get people a little bit nervous. So for us, it was important in Canada to start defining the kind of basic income we want. And we did that in a policy statement that was based on principles. So for us, some of the key things and the key measurable things that we want to see out of basic income is that it improves equality, including gender equality. It almost by definition provides greater security for everyone. and that it comes as close to eliminating poverty as we can possibly get. There's also another part that's not so much a principle, but like a guiding element of this is that we see basic income working in synergy with public services. It's not a standalone thing. It's not an either or. It's not competing with other things we need. So fast forward, then we did that. We still hear from our supporters that they need some plain language tools to be able to understand all of this and get engaged in the debate. So we produced a primer series, and one of these little pamphlets focuses specifically on Canada. It shows how we actually have policies that follow a basic income model, essentially. And those are for seniors and children. The opposite of a basic income, in our view, is pretty much social assistance, which is abhorrent, I think, to many of us for many reasons. But then our supporters and the skeptics too kept saying, but what does it really look like in Canada? What can we do? How much is it going to cost? And how on earth are we going to pay for it? And that's one of the critical things. Even the Ontario pilot started shaping, what it would look like on the benefit side, but it still didn't answer the question of how we would pay for this, on a provincial or a national level. So that's where we started. We did not start out to design an ideal model. That only works in theory. So in real life, we thought the best thing to do was to show that there are options, that our governments can take action. We can do this.
Great. Thanks, Sheila. And Chandra, there are three options outlined, not just one, not two, but three. Can you take us through the policy options that were built into this report?
Yeah, thanks for the question, Tom. And let me start by saying thanks for having me. It's a real pleasure to be joining everyone this morning and talking about this subject. To put these in context, I just want to expand on something Sheila said. Our goal with this project wasn't to come up with a definitive model for Canada and say, this is what we think needs to be implemented. It was to say, this is possible. There are options. There are ways of doing it. So what we did in this project was to pick three options that reflect different aspects of the debate in Canada to say, well, this is what it might look like if we do it this way. And in some ways, it was actually a little hard to narrow those options down. At one point, we had expanded to 6 options, and then that was an unrealistic project, so we came back down to 3. So we can't answer every question about what it looks like and how it would work and how these compare with this project. What we can say is that there are different ways of doing this. They are all possible, and they all raise specific issues or questions, particularly at the political level, that we might need to think about. But the general takeaway is that not only can we do it, there are different ways that we could do it. So to start, we wanted to be able to distinguish between the income-tested model, where only people under a certain income threshold get a benefit, and then that benefit is reduced as your income goes up until gradually it's phased out completely, and what's called the universal demogrant model, where everybody gets the same amount of money regardless of your income, regardless of your family status, regardless of your employment status. So we have models that cover those, but then we also wanted to look at the difference in Canada's existing programs and whether or not you include old age security and the guaranteed income supplement. So our first option is an income-tested model that only goes to working age adults, so 18 to 64. For all 3 options, we left the Canada Child Benefit in place because, as Sheila said, it's already a basic income, and we didn't want to get into the work of trying to figure out how to model additional changes for children. This first model leaves old age security and the guaranteed income supplement in place. So if you're a senior, you're still receiving that. And as you go from 64 to 65, you transition from the basic income to OAS, GIS. This model is structured according to family composition, which means that not everybody in a family gets the same benefit. So for the first person, you get the full benefit, which is $22,000. And for the second person, you get a reduced portion of that benefit. Now, that doesn't mean that if you are the second person in a family, you don't get the same benefit. The benefit is being paid out to the households. And that could be done in a way where the household benefit is split evenly between both partners. And the reason why I'm talking about partners is because we chose to use the nuclear definition of family, which is one adult or two adults and their children under 18 living in one dwelling. So additional adults, you know, if you have a senior parent living with you or if you have a 25-year-old child living with you, they qualify for the benefit on their own. So we picked the benefit rate of $22,000 because it aligned with the low-income measure for a single individual in 2017, which is the year that our modeling is based on, and the reduction rate that we selected was 40%. So option 2 is very similar in that it's an income-tested model with a benefit of $22,000 and a reduction rate of 40% based on family composition, except this time we included all adults. So everyone 18 plus gets the same benefit, and old age security and the guaranteed income supplement are rolled into the program, which means that the income that's paying for those benefits is now going to pay for the basic income, and people are getting a benefit based on the formula of the basic income. And the third option is a universal demo grant, where again we used the benefit level of $22,000, but everybody gets $22,000, regardless of how many people there are in your family, regardless of what your income level is, and any other factor. And for that one, then there's a higher tax rate that taxes it back. So that is the overview of our options.
Great. Thank you. Thank you very much. Sheila, so I'm going to ask the big question that's probably on people's mind. How much is each option going to potentially cost?
So this is interesting. You know, people want to know what kind of things we're getting now might go into the basic income and how might other things change. I want to say too, I encourage everybody to read the report. I mean, Chandra did a brilliant job of writing this, and the whole team put there's so much in the report that we can't cover. I'm going to cover 3 big ones. So, and a caveat. So the first area that we looked at that's going to help us fund the basic income within the tax transfer system are things that people might be getting now. So most of us, when we file our income tax return, we'll get a basic personal amount that we claim. That's the biggest. That's going to roll in, but that's a non-refundable tax credit, which means some people get it, but lots of people, the people who don't have enough money already, really don't get any value out of that. So that's the problem with non-refundable credits. Most of them, and some in particular, go almost exclusively to wealthy people. The second major area is refundable tax credits that are already in the system. So this is the basis for child benefits, like it operates on kind of refundable tax credit model. So we have a number of small ones, like the working income tax benefit, whose new name I cannot remember. The GST credit that is distributed, quite widely to people with low income, but it's very small. So we roll in some of those things. The third major area is social assistance income. So, the portion that the provinces and territories would provide to anybody who qualifies for social assistance. We used a relatively complicated formula to try to figure out, how that should work. But that's the other major piece of the income. From things that people will see already, there are some other tax changes that go into this too, to promote tax fairness and to help pay. The thing and then in the 2 versions where seniors are included, as Chandra mentioned, we would roll in OAS GIS for seniors as part of the funding for those. The thing I want to highlight in addition is what is not there. So what is not there are contributory programs like CPP and employment insurance that serve their purposes. We don't touch those. We leave money in the social assistance budget, the administrative part of the budget, in order to continue to provide essential services to low-income people as they're needed, likely have to be transformed. So for some people who worry about seeing basic income as a trade-off for these other things, it's clear that we don't think that should happen, and it doesn't have to happen. There's money in our system to do this.
That's fascinating. Thank you, Sheila. And again, if you're interested in delving deeper into the numbers, please take a look at the report, and I'm sure you'll find them intriguing, interesting. And if you have follow-up questions, I'm sure the Basic Income Canada Network would be more than happy to respond. So, Chandra, as you started getting into this research and developing the proposals, was there anything you found that surprised you in how you looked at these various options?
Absolutely. So on the surface of it, basic income seems like such a simple idea. It's so easy to explain to people that the government gives money to citizens or residents unconditionally. But once you actually get into the details of the program, it's actually quite complex and more detailed than you might think. Particularly, I would say, when you have an existing tax and transfer system with all kinds of existing programs. So one of our first challenges when we started to work with the modeler and give instructions on what kind of basic income we wanted to see was all the definitions we had to provide. So it's one thing to say you want to give people a benefit of this amount and have it reduced by this amount based on their income. Well, then the problem is, what income do you include in that calculation? And there's different forms of income used for different tax and transfer programs in Canada already. And then Statistics Canada measures different kinds of income. And the database that we used for the modeling is based on Statistics Canada data. So we had to define income using one of those measures and then adjust it to fit for our project. Another example is that we had to define what a family means. It sounds really straightforward to say you're going to base the benefit on family composition, but there are so many different definitions of family, and we needed to pick one, understanding that there's trade-offs in how you define the family, and there's maybe not a perfect way of making things fair, in that when you have more adults in one dwelling who are contributing to the family budget, then it's not like your costs are exponentially the same as the costs of a single individual. So as you start multiplying the benefit, you start giving much more income to larger families relative to their expenses than you do for a single individual. But if you start scaling back the benefit to address that, then you start disadvantaging the single individual. So that's just an example of the kinds of things we had to wade through at the very beginning. And then the other big challenge that we faced is that it's very hard to take an existing system like Canada's, which is in many ways regressive. A very large proportion of our tax system gives larger benefits to people of higher incomes than it does to people of lower incomes, and in many cases gives no benefit to people of lower incomes. But it's not like that's a straight line going up, where you can reduce it and it becomes a straight line going down. The problem is that it's often a hump that may then curve up again at the end. So when you take away these regressive measures, your overall structure becomes regressive. And one of our biggest goals with this project was to model that you could do both the benefit and the revenue side of it in a progressive way that has a progressive impact. So we first modeled a version that depended much more heavily in its funding on eliminating unfair tax measures, which I think is a fair thing to do. But what we found was then that people in the 5th and 6th income decile, so right in the middle of the income spectrum, were paying more for the basic income than people who were in the 9th and 10th, who have the most income to contribute. And obviously that was against one of our principles, and it's not really fair. Like if you're in the middle income decile in Canada, you're actually not earning that much. and you probably shouldn't be contributing the most to help eliminate income inequality. So we had to work really hard at finding ways to eliminate regressiveness while not being regressive ourselves.
Interesting. Thank you. And one of the other interesting results, and Sheila, I'll put this question to you, was really the potential impact of basic income on single adults. And we saw just recently with the new Statistics Canada data that children as a group we're seeing reduced rates of poverty, I think from 12 point something percent to 8 point something percent nationally. Seniors have dropped from 4.5 to 3.5% across the country. But single adults haven't seen as dramatic a drop in their poverty rate. So how do these interact, Sheila, for single adults, that large group of Canadians between the ages of 18 and 64?
Thanks, Tom. Yes, that's another really big question. And I think some of the trends that you've outlined really show the power of a basic income type model. Seniors' benefits have been in place for decades, and they dramatically reduced poverty quickly, and it stayed low. Child benefits, as they've grown, have continued to have a powerful impact on those families that receive it. So it shows you how powerfully those things can work. Single people, and remember, in this day and age, it really does take two incomes for most families to be able to survive. So single people are at a real disadvantage. But our public programs, and this is one of those, like, excuse me, real surprises when you start looking into our tax system, we enormously privilege couples and families with children, like nuclear families with children. So it's single people now who have the least security, the least access to anything to help them weather ups and downs. And I'll give one example of like how strange this is to me anyway, and this whole business of the nuclear family and how we decide, who fits into which category. Single people, and remember our goal of gender equality as well, single people, especially women alone, are particularly vulnerable to insecurity and poverty. But an example is a household where you have a child who has turned 18 and a parent who is 40, who are now no longer a family. They are single people, individuals. Last year, they were a family and deserving, quote unquote, of our support. So these people are still family members. They're connected. They need support, but we don't do that very well. So one of the really interesting things that I think Chandra and I both suspected, but was interesting to see come out, was a difference between the income tested models that are based on family size and the universal individual demogrant version. Mm-hmm. Both did pretty well on gender equality, so that's good. But the income tested models did a much better job comparatively of supporting single people, and they're the ones who need the help the most now. So I think we're not suggesting this is a fatal flaw of the other model, but something that would really need a lot of work to make it the kind of benefit that we want.
Okay, great. Chandra, we've seen a number of proposals that provide a higher benefit for people living on disabilities. And we saw this in the most recent Ontario basic income pilot, where there was, I believe, a $500 monthly supplement for people with disabilities. But your team decided not to do that. But that potentially leaves a person with a disability with the same income as a person without, even though they may have higher expenses, higher personal needs. Can you tell us a little bit more about why the team made that decision not to provide an additional disability supplement?
Thanks, Tom. In addition to the Ontario Basic Income Pilot, this is something we see as well with a lot of programs in Canada. Social assistance, for example, there's one rate for people who have a diagnosed disability and one rate for people who do not. And I think in some ways that reflects an important principle, but I have some concerns about it as well. So I feel very strongly about the rights of people living with disabilities to an adequate income, to have their extra expenses associated with their disability covered. But my partner is also somebody who is living with an invisible disability. He has chronic fatigue syndrome and he has been on disability leave for 13 years now. And if someone saw him, they would not know that he was on a disability. He has been one of the lucky ones in that he has a really supportive doctor who has helped him fill out the paperwork so that he is eligible for programs like the Canada Pension Plan Disability Benefit and the Disability Tax Credit. But what we see often in the disability world is a division between those who have easy to identify and diagnose disabilities and those who have hidden or difficult to diagnose disabilities, who may spend years waiting to discover what their diagnosis actually is, or who can't find a supportive doctor who's willing to go to bat for them to sign the papers that it would take in order to qualify for a program like ODSP or the Disability Tax Credit. So when we talked about this as a team, it was really important to us that everybody had access to income security, that unlike the Ontario Basic Income Pilot, we don't leave anybody living in poverty simply because they don't have a disability or they don't have a disability that's easy to diagnose. One of our core principles is that everybody deserves income security and the right to live in dignity. But we do understand that there are people with disabilities who have higher costs associated with their disability and that they need support for those expenses. But we think that support is best delivered through a program that actually addresses those costs directly and not giving everybody the same income threshold regardless of the costs associated with their disability. So in the paper, we advocate for the creation of an additional program that actually addresses those costs. And in some ways, ODSP is an example in that there is provision for certain items that people may need. It would obviously need to be a much more comprehensive program, but that is our preference, that we ensure that nobody is living in poverty to start with, and then we address the additional costs of living that individuals might have based on their particular situation.
Okay. Okay, and there may be some follow-up questions from our listening audience on that, and we'd certainly encourage you to ask those questions in a few minutes once we open up the floor. So Sheila, I want to sort of carry on with this idea that you alluded to in an earlier response in terms of incorporating seniors into a full-fledged basic income. And so as many of our listeners are aware, seniors who currently experience poverty are potentially eligible for the Guaranteed Income Supplement, which in theory is supposed to lift low-income seniors above the poverty line. What was some of the thinking that went into specifically option 2 and option 3 in terms of including seniors? And is it your opinion that seniors would be better off under a potentially new system of basic income that incorporated them, or would they potentially be the same as they are currently with the combination of GIS, OAS, and CPP?
Right, that's a really easy question, Tom, with only with several parts. So I want to answer this in a couple of different ways. First is to reiterate a bit what Chandra said earlier about some of the challenges that we find in our existing system, which is rather uneven. Even the structure of OAS GIS operates in different ways. Old age security is more like a demogrant version of a basic income in its distribution. So it goes to a lot of people more universally and on an individual basis. That can tend to benefit couples. You have two people living together. The guaranteed income supplement, on the other hand, works more like an income tested model and takes, the fact that you're either a single or living in a couple into account when it assigns benefits. So that complicates things already when you're trying to switch systems and figure out what to do. You had mentioned too that there are other programs that have helped to support seniors over the years, and that's been things like CPP, retirement savings, the fact that our tax system helps support people to encourage private savings. So all of that has really helped this cohort now. There are other things like income splitting, pension income splitting, that provides a real bonus to couples, especially in a situation where one, typically the husband, is a very high income earner and gets to fictionally transfer money to a spouse. Whether she actually ever gets that money, no one will ever know, but it's a fictional transfer, and it benefits a certain situation. So dealing with all of that makes things complicated. We have a cohort of historically extremely wealthy seniors. We have treated them very well. I am one of them. And I'm one of those people who, under our models, would likely end up paying a little bit more tax, and I'm just fine with that. The second major point I want to make, though, is that tomorrow's seniors are going to be in a very different place. They do not have secure employment. Many people are not going to get CPP the way they used to. They're barely able to make ends meet now, let alone save for their retirement years. So when we talk about seniors, we have to talk about going forward and how we make things fair intergenerationally as well.
Okay, that's a great answer, Sheila. Thank you very much. So we're going to move into audience questions in just a sec, but I do have I'm going to run an audible here, and I do want to ask both of you a question. And as all of us will know, the World Health Organization has declared COVID-19 a pandemic. And there is a bit of a burgeoning call, not just here in Canada, but in the United States. I saw AOC tweeting about it this morning, as well as in the UK and other places, calling on governments to think about providing even an interim basic income during this period of disruption and even potential quarantine in some regions. So I wanted to throw that idea out to both of you. What do you think? Do you think it's feasible? Do you think it's workable given our current infrastructure and tax system? And do you think it's sellable, I suppose? Sheila, maybe you could go first.
Oh boy, this is just devastating. I mean, it's going to be so hard to figure out, how all of this happened and how we prevent something like this in the future. A couple of important things I think strike me. It really is interesting that it has given a nudge to people thinking about this idea in a very, very serious economic and political context. The one thing that Canada does have that I think gives us an advantage in figuring out how to do this is because we do have a lot of the systems in place. We do have ways that we should be able to get money to people quickly without too much change in an emergency situation. But my second reflection on this, as soon as the outbreaks, started to really affect the stock market and all of these things, is I think it helps politicians and business leaders, other people, realize that the economy is not run by a handful of rich people. It depends on regular, everyday people going about their business to keep our society and economy healthy. And we need to do a much, much better job of supporting people to be able to do that.
Great. Chandra?
Yeah, I agree with Sheila. And one of the things we're really seeing in the last few days is a renewed emphasis on gig economy workers, low-wage workers, and the lack of paid sick days, which are not new problems. And advocates have been raising them for years, but without a lot of attention paid by policymakers. Unfortunately, in Canada's announcement yesterday, we still didn't see much that would help these workers. The uh, elimination of the 1 week waiting period for EI is very welcome. The fact that workers who qualify for EI could get it if they have to stay home for 2 weeks or longer is great. But we already know that EI only covers about 40% of workers in Canada. So what about the other 60%? And given how we have let our social infrastructure deteriorate, I see basic income as an option that could be rolled out really quickly. And despite some of the issues and questions that we raise in this paper, in an emergency situation, it could be done in a let the money flow now and figure out the details later kind of way. I think under the circumstances, it would pretty much have to be a universal demi-grant to make sense. But we know that the government of Canada has the infrastructure to do this because they're already sending out Canada Child Benefits. They're already sending out OAS GIS payments. The infrastructure of social programs is highly sophisticated these days in terms of how they know contact information for citizens and they know how to get them money quickly. And I don't see a lot of other options right now that would support people as well and as quickly when we're facing what could be potentially a quite drastic situation that could extend for an indeterminate amount of time.
Yeah, that's certainly sobering, but also hopeful in a way, I think, too, that Canada does have the capability of doing this fairly quickly, whereas other places may not be able to roll it out quite as easily as we could. I suppose it'll take some political will and some political courage. So we'll see where these conversations go in the days ahead. So thank you both for that. I am now going to open up to some questions, and I've already received a number of them. So I'm just going to go in order. And whoever wants to answer, please feel free to do so. So first one's from Gregory. Who says, I would be concerned that the income would be high enough with any kind of disability. I have chronic fatigue syndrome as well. I'm in Alberta, which is supposed to have the highest social services disability income in the country, and it's still inadequate. With rental prices here high, even in the middle range, it should be over $2,000 a month to be at the poverty level LICO. Will the QP basic income be this high? So I'm not quite clear on that last part, but so maybe I'll open that up. And Chandra, maybe you'd like to take a go at it since you answered the initial question on disability.
Sure, and let me start by saying there's no QP basic income proposal. These are Basic Income Canada Network proposals, but I just want to clarify again that they're not even really proposals in that we're taking them to governments and saying, implement this way. These are examples that we are using to start a public debate that demonstrates that this is possible and feasible within Canada's system and shows how it might work. I recognize the concerns about cost of living, and I think that's one of the most important things that needs to be taken into account when setting what the basic threshold will be for the basic income. And it's been one of the disappointing things I think that we've seen so far is that a lot of proposals have been well below the rate of poverty in Canada. But what we saw with the Ontario basic income pilot is that even though it was deliberately set below the poverty level, it made a huge difference in people's lives. And I just want to stress that we should not reject a proposal of basic income just because the income might not be as high as it could be or we think it should be. I think we have to evaluate each option carefully, but recognize that the structure and model itself of basic income provides additional benefits to people, such as autonomy and dignity, that allows them to make their own decisions, gives them security for things like transitioning to work or school, gives them the opportunity to expand the number of choices, and that, I mean, that in itself is immeasurable.
Okay. Thanks for that, Chandra. I have a question for Sheila. So it's from John in Ontario, and Sheila mentioned that the second model is more favorable than the demographic model for women transitioning from family to single. John would like to know, how does that play out?
Yeah, this is a complicated question, and we'd have to go deep into the modeling of the differences between the income tested model and the demographic model. But I think if you picture in your mind a couple of different families, it helps illustrate. So you might have two families who each have 4 people in them. One of those families might be a single parent with 3 children. Let's assume she's female. She faces disadvantage in the labor force to begin with because she's female and can't expect the same wages. She faces disadvantage because she's a lone parent and is expected to both earn income and care for her children. And yet she only gets her basic income of $22,000 under this demographic model. Her children will get some, but they'll get smaller amounts through the child benefit. If you contrast that to another family of 4 people, where 3 of them in the same household are all over 18, so you have parents and an older child or 2 older children, or no children, they are going to have, at the outset, quite an enormous amount of money amongst them, all capable of earning, we assume. So their opportunities for well-being are so much larger than they are for that single parent. So like that shows you how different family types matter. The proponents of the demographic model, very strongly identify autonomy and freedom and that sort of thing as being a benefit of that particular model. But it doesn't always work out that way because, as most of the feminist literature has tried to explain, people don't live in isolation. We are not islands. We are all not self-interested individuals. We live in social contexts, and those are families, not just nuclear families, but extended families where single people are our cousins and our older brothers and sisters and our non-senior grandparents. So it takes a lot to try to develop a model that's really going to be helpful to the people who need it most.
Great. Here's another great question from Lynette. And do you propose geographical adjustments? For example, the cost of living in Toronto is higher than in smaller cities. So this is something that's been looked at potentially for social assistance rates, regional rates dependent on cost of living in certain areas, and as well as living wage. So maybe I'll throw that over to Chandra. Any thoughts on cost of living of renting an apartment in Toronto versus living perhaps in a place that doesn't have as high expenditures?
Mm-hmm. That is something there's a lot of debate over, and you do see models that do take into account the cost of living. They can be very hard to administer in that it's hard to define the geographic boundary at which suddenly your cost of living drops, and then to locate people in that boundary. So, there's a real level of administrative complexity, which doesn't mean it can't be done, but that it's much more difficult. But at the same time, there's the possibility that if you set the benefit level high, which is what we did at the low income measure for, which is based on all of Canada, it's not based on a particular region, that regions where the cost of living is not that high, the basic income ends up serving as a regional stimulus or benefit. So I encourage you to check out the paper. In the back of the paper, we actually have a chart that shows the impact of the basic income on disposable family income by province, which shows that there is a significant difference between different provinces as to how much your income increases. Now, it does depend a bit on the fact that certain provinces have much lower incomes to start with, but it just goes to show that in some provinces like Atlantic Canada, for instance, your basic income boosts your income a little bit more, which means that the basic income goes a bit farther. And at a time when they're seeing a demographic shift where young people are leaving the region and old people are coming to retire, and they're concerned about the future of their workforce and who's going to pay for their social programs, this basic income might be the program that allows young people to stay and might be the economic stimulus that the region needs in order to create jobs that those young people can have while they're there.
That's fascinating, and what you might see is a movement of people from bigger cities to more rural areas where costs won't be as high. Yeah, it would be interesting to see how that could potentially play out in the years ahead. So Chandra, I have another question about the disability supplement or the lack thereof in the options, and this one comes from Laura in Ontario, and it takes a bit of a human rights lens. So in the report, you stated that you are not recommending a disability supplement, citing making everyone equal, and you've reiterated that. But under international human rights, the right for all to have an adequate standard of living is achieved through equitable, not equal share. If equal was the case, Canadians would be capped on their healthcare use. So the follow-up is a disability supplement not only helps with health costs, but also the fact that people with disabilities earn half of what their peers earn who are without a disability. So would you, to encapsulate, would you consider revising that position?
So I have two thoughts in response to that. Number one is that when we set up a program that provides greater income to people with disabilities, we always say people with disabilities, but what we really mean is people who have a disability that is easy to diagnose, who can meet the standards of a bureaucratic program. So there are people living with disabilities now who do not have a diagnosis, who may not be able to get a diagnosis, who also have trouble working, who also have trouble earning money. We also have people who have no diagnosis, but also have trouble finding enough employment to meet their basic needs. Or it's not even necessarily finding enough employment, it's finding employment at a wage level that will meet their basic needs. And I do not support any program that would leave those people living in poverty because they can't get a diagnosis or because they are considered able-bodied. To me, it is an absolute non-starter that everybody be raised out of poverty regardless of your situation. But where the aspect of equity comes in, I think, once you have provided income security to everybody, is the additional costs of living. And that's why what we propose is a program that targets those additional costs of living directly. And that could be done in a way that limits the emphasis on diagnosis, which I think makes it more fair and more accessible to the many people now who are being excluded from Canada's disability programs.
Okay.
Yeah, if I can add to that, Tom.
Yep.
Because I think both that and the cost of living question kind of address this larger issue of what is a basic income and what any one program can do. You know, like the basic is ensuring that there is this, you know, assurance of security and a floor below which nobody is going to fall. And it's a springboard to help you, you know, weather ups and downs in other parts of your life. It's not meant to fix every other problem that's there. The irony is that having a basic income actually would help so many of those other problems become smaller. but it can't address everything.
Mhm.
So having, regional cost of living adjustments, maybe the city of Toronto, for example, could use some of its tax dollars or other mechanisms to reduce housing costs, maybe to help deal with some of those cost of living issues. For people with disabilities, I mean, the difference between, somebody with an issue that really doesn't impact them so much from a cost perspective, even though it might impact other parts of their lives, compared to somebody else who needs $2,000 a month for prescription medications. A flat rate benefit distributed across the board to everybody isn't going to meet that need very well.
Okay. Thanks, Sheila. So I have a bit of a high level question here from Jack, who is fairly new to the discussion about basic income. So what are the benefits to society of providing a guaranteed income to people? For example, lower medical costs. So Sheila, maybe I'll turn this over to you, since I'm sure you could rattle off quite a few in a few seconds.
So thank you, Jack. This is actually one of those questions that Tom himself can probably answer better than anybody, because he's been so closely involved with pilot participants in Ontario, in the Hamilton region and beyond. I think, one of the most important things to stress is that when you start looking at the evidence from pilot programs everywhere, including the recent one in Toronto, to ones in India, Finland, if you look at our own experience with seniors and child benefits, you see differences in quantity and precision, but you see the same pattern. You see improved health, you see improved outlook on life, you see improved ability to actually enter and engage in the labor force in ways that you couldn't before. Some people, when they started receiving a basic income, were able to perform better at work and got promotions. People are able to go back to school. To make the individual circumstances of people's lives are so diverse. Like, no bureaucrat running any kind of a program is going to be able to make better decisions than you can about what is going to make the difference in your own life. Chandra also alluded to the idea that there is not just an individual and family component to this, but a community component. That when you have more money and more security in a community, you'll have small businesses who are able to thrive that couldn't before. You can see movements away from people moving to the big cities, hoping to find opportunity that isn't there. Have the ability with a basic income to create opportunities. Some of the studies, again, internationally, have shown an increase in self-employment and entrepreneurship, because people have that ability and that chance to do it.
Great. Thank you, Sheila. There are so many good questions that are lining up here, and I'd love to be able to get to all of them on this call. Unfortunately, we're running out of time. So there's a great one about immigrant workers. There's another great one about engaging with Inuit, First Nations, and Métis groups. And what I will suggest is that maybe Sheila and Chandra could answer some of those questions later on by jotting down some responses, and we'll post that when you receive your follow-up emails. So we only have a couple of minutes left. So I just want to get to this last question, which I think is pretty critical, and it's from Annie. And it is, what is your sense of the political palatability of different options, and where do you see opportunities to push this forward politically? I think that's a great way to end, and I'll turn it over to Chandra and then Sheila.
So I wouldn't have expected to say this answer a week ago, but I think the political palatability is changing by the day. So I'm not entirely sure I can answer definitively today. What we see in Canada is we have a lot of comfort level and familiarity with programs that are targeted to a particular demographic and that are based on your income level. So like the Canada Child Benefit, we know how that works and we're familiar with it. Introducing a universal demo grant would be a whole new thing for us. And then there's the political challenge of the numbers. As Sheila was saying, there's a difference between the gross cost and the net cost. And the gross cost of a universal demo grant is much higher. And then when you look at the net cost, it's actually quite similar to an income tested model. But the challenge is that, you know, that's not how people make political decisions. And when you look at a total cost that may be triple the existing Canadian federal budget, that's a big challenge for people to swallow. But as I said, you know, things are changing daily. We may reach a point with this coronavirus crisis where that is entirely politically palatable. And, you know, that's seen as both a needed economic stimulus and as a way to keep people home when they're sick. So, you know, stay tuned, I guess. And for opportunities to push this forward politically, I think it's just constantly having the conversations with decision makers about the impact that income inequality is having socially now and what it is going to have on the next generation. We already have millennials who can't afford to move out of their parents' home, who can't pay their student debt. So what happens when, you know, that is the bulk of the people who are supposed to be paying for our programs while the older generation is in retirement? And then climate change, I think, is another opportunity where we have to talk about doing things differently. And governments are slow, but starting to understand that we need to think about doing things differently. And basic income could be part of the solution to climate change.
That would be an incredible webinar all to itself, I think, talking about those interactions. Sheila, I'll leave you with the last word on this.
I don't have a great deal to add to what Chandra said. I think over the last few days, our ability to imagine what might be possible is and necessary is changing dramatically. I would say that in recent months even, we within the Basic Income Canada Network have seen increasing political interest in this. And interest from the public. Everybody comes at it from a different perspective often, however. The high-tech guys and many people are worried about the robots are going to take all of our jobs. And then other people say, well, nah, that's not really going to happen, so we don't need to worry about this. This current crisis points out that this is not a future problem. This is a historical problem that we've had for some people for a long time. It is a current problem, and now it's a current crisis. And amongst the many, many reasons why basic income would be a positive development for us, its effect as an economic stabilizer is huge.
Thank you, Sheila. And certainly sobering, and added to that, I just saw a notification come over my screen that Prime Minister Trudeau is now self-quarantined because of exposure. So certainly the days ahead will be challenging, but take care of yourself, take care of your health. We will get through this, and there will be a brighter future ahead. So thank you both very much for participating. Thanks to all those who listened in, and Natasha, I will turn it over to you.
Thanks very much, Tom, and to Sheila and Chandra. That was great, really helpful. I learned a lot today. Just a couple of closing announcements. If you would like to learn more about basic income and other poverty reduction practices, you can join the Cities Reducing Poverty Network, gain access to useful blogs, tools, webinars, and more to help you in your poverty reduction work. And also, we'd like to invite you to save the date for the End of Poverty, October 14th to 16th, 2020 in Calgary, Alberta, hosted by Tamarack's Vibrant Communities. The end of poverty in Canada is coming closer and closer to becoming a reality. And at this 2.5-day gathering in Calgary, you will learn from inspiring keynotes and peer leaders, take masterclasses on financial sustainability, leadership and evaluation, and learn how we can eradicate poverty in our lifetime. In the lead up to October's summit, continue to be part of our online conversation as we explore some of the most impactful strategies that will finally help us end poverty in Canada. Next month, James Hughes from the McConnell Family Foundation will join us to share 2 defensive and 3 offensive strategies to end poverty, April 16th from 1 to 2 p.m. Eastern. And finally, systems change can be complex and overwhelming. We can feel frozen, unwilling to move forward, and fear making the wrong move will lead us to perilous results. But Cameron Norman and Liz Weaver will explore the role of individual leadership in systems change, learn how you can use your personal power in systems change context. Cameron will describe how wise actions will enable you to navigate and ratchet systems change. May 12th from 1 to 2 p.m. Eastern. And finally, in a few days, you will receive our follow-up email, which will include the resources that we were discussing today, a link to the audio recording of our call, as well as the learning opportunities that I just mentioned. You can email me at natasha@tamarackcommunity.ca to provide your feedback about today's webinar, because we're always trying to improve on our experience. So thank you again for joining us, and have a fantastic day.